Hi, before we start this ASMR video, I'd like to thank all these members on my Patreon for their continued support. If you're looking for any content that I create on other platforms, check the link below. Now, let's get into the video. Welcome to your cranial nerve exam. This will be a lengthy exam today. I will be going through a variety of steps, many steps of testing your cranial nerves, making sure that not only are you fit to drive, fit to continue on doing your work, but just making sure that you are a healthy individual in general. I'll start by obviously being sanitary and putting on my gloves. You can't risk people getting sick in today's times, so wearing gloves is obviously a standard that some practitioners do not partake in. More of the old school, generation, I'd say. So, shall we begin? I'll be doing a variety of tests to your eyes, to your ears, to your nose, your tongue, your lips, sections on your face, sections on the back of your head, feeling along your scalp, on your forehead, testing your shoulders, your arm strength, and your push strength in terms of your push and pull. First things first is testing your memory, but just also making sure I have the correct client in front of me. So could you start with your name, please? Great, thanks. And your age? Good. I know that you know these, and I can obviously see these characteristics and things on you, but it's just testing your memory at the same time. Your date of birth. The color of your eyes. Your weight. That's great. Any history of medical diseases in your family, past history? None? Okay. That's a good thing. It just means that, genetically, sometimes traits get passed along to us from our family members in previous lives, and that can just cause some concern. No history of any other types. Good. That's great. I'll be starting off with the first cranial nerve, looking at your eyes. Easiest thing to start with, to begin with. So if you can just be as still as you can for me, and I will just give you a variety of instructions for things to do. Just essentially at this moment, follow my instructions. Just do what I ask. If you could please look up into the ceiling for me. Just look up. Thank you. Good. Can you see the light when I'm shining it up into your eyes like that? Great. And how about when I shine the light up into your eyes? Right up there. Good. Any difficulties with that? Any double vision? How many fingers am I currently holding up? Great. Look down for me. Good. Any double vision there? Look down again. Any double vision there? Great. If you can just look that way for me. That's good. To the other side. Any double vision there? Excellent. Again, how many fingers? Good. Do you remember the first finger that I showed you on how many fingers that were? Great. I'm just going to be coming into your eyes with the light now from side to side, from the bottom and the top. I'm just looking at the dilation of your pupils to see if they're equal and reactive. Obviously, as you can see here, these are what I'm referring to in terms of how your eyes react to this. I'm going to be going in that eye first, so just look past me, look right past me, look at that photo for me. Good. That's great. Awesome job. Has your left eye always done that? It has. Good. I was just noticing it wasn't as reactive as your right eye. Your right eye would constrict and react to light almost instantaneously, where your left, it lagged a little bit. No worries though. Just gonna test that again. Test that other eye one more time. Good. Any double vision while I do that? You can still see me. Is there any light in your eyes right now? Good. Just look up for me one more time. I just want to look at something right there. I'm just going to pick your eye up here. Pick your eyelid up, I'm sorry. And then the other eye. I'm just going to pick that eyelid up again. Good, and just look down one more time. Okay, I'm not worried about that. I just wanted to make sure that the surrounding eye was in good health. Your pupils look great. The irises look great. The whites of your eyes, fantastic. Now I'm just going to stand back a bit. You just tell me if I get blurry or if I do not get blurry. So, can you still see me quite well? Good. How many fingers? What am I doing with my fingers? Good. When they were that close to your face, was it hard to see them, or did your eyes focus on my fingers? Great. How many fingers am I showing, and is this blurry or is this clear as I get closer? Blurry or clear as I get closer? It's blurry right now. Okay. Am I in focus? Good. That's alright. That's alright. It's nothing to worry about. Now I'm going to be coming in different angles. We're going to test your peripheral vision. So you won't know where I'm coming in. I'm just going to appear from corners of your eyes the sides, the tops, etc. Just say yes when you see my fingers. Was that hard? Could you see them quite clearly, or was it a little blurry in the sides of your eyes when you saw those lights come in? Good, alright. Any difficulties there? Good. Next, we're going to move on to your ears. This one won't be as intense. It's more just testing sections of your ears, just making sure that you can hear my voice equally in both ears. So I'm just going to have this. Now, does that sound equal in both ears at the same time? It does. Good. No issues there. I'm not really here to do a hearing test today, but as long as it's equal in both ears, that's all I'm worried about. I'll put this down. We won't need that again. Now, I'm going to do a little puff of air into your eyes and then just have a very quick look at them quite close up. So I'm just going to clean off the sections of your eyes here. Just, could you close your eyes for me, please? Thank you, thank you. Alright, I'm just going to get very close to your eyes. I just need to check your retina, but on the back side of your eye where it attaches. So just getting extremely close. I do apologize. Test out this side. Good. No issues there. Won't be needing that again. Just gonna write some notes. Just keep yourself busy for a second. I'm just gonna. Just writing about your left eye, how it was slow to react. Good. Alright, so we've done your eyes. I've done your ears. We're going to do a little bit of a smelling test. Excuse me, a little frog in my throat there. I'm just going to wave this. Where is that? There we are. Just going to wave this in front of you. Just tell me, what does that smell like? Just underneath your nose there, what's that smell like? You're correct. And this? What does that smell like? And this? What does that smell like? Good, 3 for 3. Every person has sort of a unique way of what they smell, but yours was spot on. No issues there. So your hearing is good. Your smell, good. Your eyes, fantastic. I'm just going to have a reach around the back of your head here. Just feeling along your neck. Just any lumps and bumps quickly. Along the top of your head. What's this piece right here? that piece right there. That's okay. It was just a little bit of your hair was matted. You must have not had a shower today and just came with your bed head. That's fine. It's a doctor's office. You're not here to impress me. I'm here to impress you with my practitioner skills. Good. Just get a little feel around your face. I'm just looking again for any lumps and bumps on your face. Anything that seems sort of out of the ordinary. Now this spot right here. That one. Is that new? No, okay. What that is hyperpigmentation. It just means you've been out in the sun a little too much in that specific spot on your face. I've actually got one right here. Sorry, that piece right there. It just means the sun has gotten a little too much on your face, and it doesn't mean anything bad. It's not the C word at all. It just means too much melanin was essentially dealt with in that moment, and because of the sun and its UVs, it's just sort of discolored your skin. Nothing to worry about. There are treatments out there that can fix that. Okay. Just having a gander at the rest of your face. Great. Now we're going to get on to a push-pull section where I am going to take your arm like so, and you're going to resist as I pull it and push it away from you. I'll be doing the same thing with your shoulders. As I push down on your shoulders, you will be pushing up. I will then go under your elbows, and I will be pushing up as you are pushing down. Just testing more of, you guessed it, your cranial nerves. So let's dive into that. Great. So, one thing I didn't do, I know there's a lot of nerves in your eyes that connect with your cranial nerves. I didn't test your vision in regards to closing each eye individually, so I do apologize. So, I'm going to have you cover your eye. Let's cover that eye. Great. Can you still see me? Great. Was it harder to see me? Easier to see me? You decide and let me know. Good. And let's cover that eye. How's that? Any easier to see me? Can you still see me? Great. Let's cover your entire both eyes. Can you still see any peripheral light around your eyes? As I move it around your eyelid, can you see light entering in different shades and areas? Great. No need to worry there. We're done with that. I just needed to finish that portion off. And then the last part, actually, I just need to check the symmetry of your retinas in relation to your nose to make sure that what you're seeing is, in fact, straight-eyed seeing. So just stay there for a second, please. Let's see. Just stay there. I'm going to get nice and close and look at your distance apart. Excellent. That's the one measurement. I won't need those anymore. Let's write a little bit of these notes in so that I can dictate your findings later. I'm just going to write down about your ears, the hearing, a little bit of your eyes there, and then your sense of smell. note that your smell was superb. Now I got a little bit of that powder on your nose there. Sorry from what I had you smelling those things, so let's just clear that off. Try to hold that sneeze in. Good. Let's just look up. That's good. Cleaned all that off. I do have a pair of scissors. I just need to. While it's okay to have nose hairs, totally fine. These are surgical grade scissors. An abundance of them, too many of them, can cause congestion, so I'm just gonna clip a couple of the nose hairs just off around the center there. Just perfect. That's great, that's great. How you feeling? How you doing? You doing good still? Do you need a break? I know it's a lengthy exam, but I want to make sure that I'm thorough with it. Before we get onto the push and pull section, I'm going to listen to your heart. Obviously, it's not one of your cranial nerves, but it is crucial in terms of keeping those cranial nerves active with blood flow. So, I'd like for you to just be calm, breathe normally. Good, good. Sorry, I know it's a little cold. Okay, take a deep breath in for me right now. Good, good. One more deep breath. Let's check the other side. May as well check your lungs while I'm here. Okay. That's alright. I'm going to put this on the back side of on your back, and I'd like for you to repeat the words 99 to me, okay? Go ahead, say the words 99. Good. And again. And again. And again. Good. We'll do the lower lobes. The lower lobes. Go ahead. And again. Great. And again. Just going to go back up to that top section one more time. And again. And again. Good. Your heart's totally fine. I won't be needing this again, just doing that one test. Getting down to the final bits of tools that I have left where I'm going to be examining your eyes. Won't be needing that either. Or that. Once I run out of tools, that means the test is done. Now we're going to move on to your cranial nerves, like I said, where you push and pull. Push and pull. So the first thing I'd like you to do is put your arms up one at a time like this. Just a single one. You can pick whichever one. Good choice, good choice. I'm going to put my hand on that and I'm going to pull towards me, okay? Alright, so here we go. Hand there, and resist, resist, resist. Keep going. Excellent. Was that hard at all to resist me pulling? Obviously, I'm not going to pull with all my strength, but I want just enough where I can see your nerves and muscles working in conjunction with each other. Good. Now, let's do this one here. And ready, and pull, pull. Sorry, I'm pulling. You resist, resist, resist. Was that hard? No, that I did not toot. That was the gloves. They made a little weird noise. I would never do that in front of my patients. Good. Now I'm going to be doing the same thing, but with both hands, and I'm going to be pulling at the same time. So, both arms up like this for me, please. Thank you. And resist, 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 resist. Great job. We're going to do that same sequence, except I'm going to be pushing, pushing, and then pushing. We'll start with the same arm as last time, okay? I'm going to push towards you. I want you to push As you can tell, I would never do that in front of my patients. Next time, you gotta have some humor when you're being a doctor, and resist, resist, resist. How was that? Was that hard? It was. Harder than normal. Like, I found that when I was pushing, this arm was sort of letting it go a little bit faster than this one. Do you work out? You don't. I'm suggesting that you incorporate health fitness activities into your regime somewhere along the line. Studies have shown that if you incorporate exercise into your life, statistics show you will live longer and healthier with less complications in your skeletal muscle, your skeletal or muscles in general. Good. I'm going to be pushing down on your shoulders now, so just get as comfortable as you can. I'm going to push down like that. So here we go. And 3, 2, 1. Resist, 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 resist. How was that? Was that hard or easy? Good. Now I'm going to be pushing up on your elbows, so just arms by your side. Create a 90-degree with your elbow like you're holding up a board. I'm going to push up on your elbows. I'd like for you to push down with your shoulders. Don't let me push your shoulders up. Alright, here we go. And resist, 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 resist. Good. I'm not going to push too hard. That was excellent. You did a great job there. How did that feel for you? Not too hard. That's good, that's good. Let's write that down. Okay, so we've pretty much come to the conclusion of our test. Let's just clean off that. Sorry, there's a little bit of that smelling powder on your face. There we go. Now, do you have any questions for me? Other than our next session, 3 to 6 month timeline to retest those cranial nerves, as I now have a baseline of what I'd like to do for you, how I'd like to go forward using those incremental levels. I'm just having a look into your ears really quickly. I did a little test for the hearing, but let's just see how healthy the inside of your ears are. That's good. And then this side. Great. I'm happy. I hope you're happy. Obviously, if you've had a good session today, Margaret's just outside the door, and as always, you know she doesn't take payments from you. No. She just appreciates a comment and a like, and if you can subscribe to her newsletter, she would be so appreciative of subscribing so that she can book you in for your next appointment. So I'll see you at the next one.